So this is a adjuvant breast cancer trial for early stage resected breast cancer, 2,437, largely postmenopausal women, receiving standard therapy that was available in 1994. So that would be tamoxifen receptor positive, chemotherapy, but only 6% taxanes, no HER2 status or HER2 targeted therapy, and other therapy is appropriate. So the dietary intervention, women were then randomized to a lifestyle intervention targeting dietary fat intake reduction. Getting a little bit ahead of ourselves, that intervention worked in reducing women's percent calories from fat from around 30% to 20%. It was associated with, though it was an intervention target, with about a 5%, 5 to 6 pound weight loss, which both were statistically significant. At the time of 60-month follow-up, there were 24% fewer recurrences, but no significant difference in survival. Funding ended, our ability to contact patients ended at that time. So now we're talking about a death registry follow-up. So we're largely only able to find women who died on the study. And then here's what happened. So the intervention went for 5 years when there were fewer overall deaths in the population in the dietary group. So 13.6 versus 17%. That difference was bigger, about 20% at year 10, but got drifted away. So at 20 years, the hazard ratio was 0.94. It was not statistically significant. But we looked in the subgroups, of which we had previously seen a greater relapse-free survival benefit in ER-negative women. So now when we look at ER-negative women, we see 36% longer survival, which was about 1.7 years longer median survival. And the effect was a little bigger at 10 years and then drifted off. When we look next at the ER-negative, PR-negative group, and we didn't have HER2 status, but now we know from the SEER data that if you start with ER-negative, PR-negative, that means that 73% will be triple negative. So this is 3/4 triple negative cancers where we really have made no advances in the last 15 years. We've been to this meeting and things just don't work. Those are rapidly recurring, rapidly fatal cancers. In that population, overall, there was a 54% improvement in overall survival, and with 2.3 years median increase in survival. At 10 years, the increase in survival was 69%. So big increase, but in exploratory subgroup analysis, in a post hoc analysis. So that's where we are now.